Order. Debbie Abrahams to move the motion.
Thank you so much, and it's a pleasure to serve under your chairship, Ms. Rees. I'd like to thank the Backbench Business Committee for granting me this debate to discuss the huge inequalities in dementia diagnosis and other services across the country. I'd also like to thank Alzheimer's Society for providing the secretariat to the APPG and supporting our many inquiries, including the inquiry we conducted into dementia diagnosis last year, which was published in our Raising the Barriers report. Particular thanks go to Lewis and Connor for their briefings and in helping to prepare for today's debate. It's a real honour to have been recently re-elected as co-chair of the all-party parliamentary group on dementia, a position I've held since 2015. My other co-chair is Baroness Angela Browning, and like Angela, I became involved in the APPG because we became carers of loved ones who developed one of the brain diseases that causes dementia. In my case, it was my mum, also called Angela. She was diagnosed with Alzheimer's disease in 2002 when she was just 64, and I cared for her along with my stepfather and brother. After she died in 2012, I became the first MP to train as a Dementia Friends champion and subsequently was elected as co-chair of the APPG on dementia in 2015. Ms. Rees, this debate could not be more timely, as you will know. This week marks Dementia Action Week. Yesterday, I had the pleasure of sponsoring Alzheimer's Society's reception into Parliament for Dementia Action Week, where we welcome many members to hear about the importance of a dementia diagnosis and the transformative potential of new treatments for dementia. Back in January, I spoke in another Westminster Hall debate looking at the advent of new treatments, particularly lecanemab and donanemab. These drugs have been causing huge excitement as they mark the first ever treatments for people in the early stages of Alzheimer's disease and could change the way that we see dementia forever. However, even in that debate, I highlighted the barriers to those drugs being delivered to patients and sounded a note of caution that these drugs are neither a cure nor a quick fix. And I was really reassured that in terms of the approval of lecanemab and donanemab, that is going through the regulatory cycle at the moment, and we hope to hear in the next couple of months in terms of when they will be available. The fact of the matter is that dementia is a monumental pressure on our health and social care system, but it's all too often an afterthought in commissioning. It's not known that dementia is now not commonly known that dementia is now the leading cause of death in the UK. Nearly 1 million people have dementia, but of those, 1 in 3 are currently living without a diagnosis. Dementia costs the economy more than £40 billion each year. More than 60% of that cost is borne by individuals and families. These facts may come as a surprise to many, including many commissioners. But today I want to focus on 2 important inequalities in dementia: the inequality in dementia diagnosis rates between different parts of the country and different groups of people, and also the inequality between those who have and do not have access to post-diagnostic support. But first, some information that hopefully will be found useful. First of all, when we talk about dementia, we're using a collective term that covers the common symptoms associated with a range of brain diseases, of which Alzheimer's disease is the most common, but which also includes vascular dementia. My mother-in-law had vascular dementia, Lewy bodies, frontotemporal dementia, and many others. Each of these brain diseases has different pathology and as a consequence will have different therapies. Right now, there are more than 900,000 people living with dementia in the UK, as I've mentioned. Due to our ageing population, this figure is set to rise to 1.6 million by 2040. But I need to stress that dementia is not an automatic part of ageing, although it is more prevalent in older populations. People with dementia account for more than 70% of the residential care home population over the age of 65 and 60% of people receiving home care. Meanwhile, as NHS performance data published early this year reveals, it's estimated that a quarter of NHS beds are occupied by people with dementia. and they remain in hospital on average twice as long as people who don't live with the condition. Unfortunately, that reflects the crisis in our social care system and not being able to safely discharge people back into the community or residential care. I reflect on where we are in relation to our social care system and the opportunities that we've had, for example, through the Dilnot proposals back in 2015. And I really do hope that this focuses the minds of all of us in what we do, and I certainly will be have been supportive of a national care service for many years now. Dementia diagnosis is the key which unlocks vital care and support for people living with dementia, particularly those who are struggling to manage their symptoms alone. It helps people to understand their condition and allows them and their loved ones to start planning for the future. But as I mentioned earlier, currently just 1 in 3 people estimated to have dementia receive a formal diagnosis. The benefits to receiving a diagnosis are massive: access to new treatments and the care and support that's needed. Alzheimer's Society reported earlier this week that just 91% of people with a dementia diagnosis saw real benefits to having received one. However, the dementia diagnosis rate in England dropped from 67.6% to 61% during the COVID pandemic. Currently, it's about 64.8% in England, below the national target of 2/3.
Will my honourable friend...
I will, happily.
I'm very grateful to my honourable friend, and I commend her for not only securing this debate, but the powerful work she does in this area of policy. She raises the national target of 2/3 of people to be diagnosed with dementia. I don't believe that is nearly ambitious enough, but is she also concerned that there are huge variances across the country? How can it be that a place like Stoke can get 90% diagnosis and a place like Swindon 50%?
I'm very grateful to my honourable friend for his intervention, and I'm going to come on to this because this is the absolute crux of the issues that we're facing. So first of all, yes, it's not ambitious enough, but then, as my honourable friend rightly says, there are these inequalities. I prefer calling a spade, so these are inequalities, and we need to call them what they are. So although the national picture is poor, when we dig further into the data, we can see that there is a huge regional inequality in dementia diagnosis rates. In my Oldham constituency, for example, the rate is above 75%, and in Devon, it's just 40%. Where you live has a massive impact on whether you get a timely, accurate, and high-quality dementia diagnosis. A postcode lottery on this scale for a condition which will affect 1 in 3 of us is not acceptable. The APPG's Dementia Diagnosis Inquiry revealed several issues. There are significant differences between integrated care system areas in England in terms of the dementia diagnosis rate. The report referred to a recent survey of clinicians, CCGs, the predecessors of the ICSs, and dementia support workers by Alzheimer's Society, where poverty and health inequalities were identified as major barriers to getting a dementia diagnosis. And this was also borne out from the analysis of the Office of Health Improvement and Disparities. I just have to say I don't particularly like that title of the organisation. As I say, I think it should be the Office of Health Improvement and Inequalities. Similarly, there were lower rates of diagnosis in ethnic minority populations. So, for example, the city of Wolverhampton has an overall diagnosis rate of 70%, but this is just 35% for people from an ethnic minority community. Alzheimer's Research also undertook an analysis and published a report last October towards brain health equity, how can governments tackle inequalities and dementia risk. And this highlighted research identifying vulnerable groups and the dementia risk that they face, because that is also an inequality. It referred to research in England and Wales that showed socioeconomic deprivation and ethnicity are linked to increased dementia mortality, younger age death from dementia, and poorer access to specialist diagnostics. And they made a number of recommendations around this. We know that there are 12 modifiable risk factors associated with dementia, and they focused on action around reducing air quality, reducing air pollution, lower smoking rates, healthy eating, tackling higher blood pressure, and also identifying and treating hearing loss. But back to our APPG inquiry. We received input from more than 2,300 people, and I do thank them very sincerely. And they are people that have gone through or have gone through with a loved one a dementia diagnosis process. They shared their experiences in our survey. And what we found was that every part of the country produced different experiences of the diagnosis system. In Somerset, for example, people were most likely to report that they were satisfied with the time it took for them to receive a diagnosis, but were least likely to say that they received satisfactory post-diagnostic support. In London, respondents had the best access to brain scans, but found it most difficult to access GP appointments. I know that £17 million was invested in dementia diagnosis by the government in 21-22, and that part of that money was to develop best practice advice. Can the Minister... I will do, yeah.
I commend the Honourable Lady for calling this debate, but also the work she's doing through the APPG. I just would say this, and I say to the Minister as well, that today we are seeing more people being diagnosed with dementia and dying more than they do with other conditions, such as heart disease and cancer. So why is it? Why does she think it is that we're not investing more resources into research and support for people that suffer from this terrible condition?
The Honourable Member is absolutely right. There is less money going into research. In terms of why there isn't more done about it, I think you really need to direct that question to the Minister. I think I've set out all the evidence that says it should be a priority. It should be a priority for the families and individuals affected, but it should be a priority for our society and reflect also how we organise our care system, given that predominantly the people within the care system are those that are living with a diagnosis. You'll have to direct that question to the Minister. So my question to the Minister is, given that there's been this investment back in 21-22, if she could possibly update us in terms of how that's going and the improvements that she may not see immediately, but she hopes to see. And clearly this is something that we need to be seeing as part of a levelling up agenda. So, as I said before, 2,300 people filled out our online survey and shared their story to inform our work. Sadly, just 5% of people's stories were positive. 5%. That's awful, isn't it? Indeed, following a constituent coming to see me regarding concerns about the delay for her mother's diagnosis, it took her 15 weeks to get an appointment for a mother to attend for a dementia diagnosis, during which time she noticed a considerable decline in her cognitive health. I tabled some written parliamentary questions on the proportion of people waiting more than 15 weeks for initial dementia diagnosis and the average waiting time for an assessment, and was told in response to that these data were not held centrally. To be honest, I find that extraordinary. And given that national strategy should not just reflect the evidence that we have, but the data that we have on a national, the national sort of profile around dementia, then I think we should agree that this needs to change. I will.
So, my constituency, the London Borough of Havering, second highest number of older people in the whole of Greater London. So at the moment it takes over 16 weeks for the diagnosis, the average of 16 weeks for the diagnosis to be revealed. But of course, the longer people wait, the more damaging, the quicker the diagnosis, the better. It's so important that we reduce the length of time that people have to wait to know the condition that they're suffering from. And so I fully support the Honourable Lady in urging the government to make this a greater priority.
Debbie Abrahams.
I'm very grateful to the Honourable Member for that, and yes, I would agree with him absolutely. So this underlies for me the importance of improving the dementia diagnosis pathway and making it work better for people living with dementia and their loved ones. The APPG has developed a series of recommendations across the core themes of dementia diagnosis, data, workforce and public health messaging. Collectively, these recommendations outline how dementia pathways can be strengthened to enable access and quality care across all settings, communities and regions in England. I'd be grateful to hear from the Minister about what work the Department is undertaking in these areas to reduce inequalities in the experience of dementia between localities and population groups. I want to turn now to inequality between those who have post-diagnostic support for dementia and those who don't. Or perhaps more insidiously, the gap between what people with dementia are supposed to receive and what they actually receive. Guidance states that people living with dementia should be offered a review with a healthcare professional at least once a year. Just 25% of people with dementia polled by Alzheimer's Society said that they or their loved one had had an annual dementia review within the last 12 months. And only 16% said that they had received enough support from local services in the last 12 months. More than half of people said that even if they had received an annual dementia review, it did not help them feel more able to manage their condition. This trend continues outside of primary care and allied health professionals. Over half of people with dementia who had been signposted into mental health services report having to wait up to a year for treatment. Evidence shows that mental health treatments can be effective in treating depression and anxiety symptoms associated with dementia, but just, and I'll get my notes right, 0.002% of referrals to NHS talking therapies are for people with dementia. That's 2,000 people out of 1 million referrals. A quarter of people with dementia wait for up to a year for occupational therapy after referral. Now, occupational therapy can help to prevent dangerous falls and help people live well in their homes for as long as possible. The average time spent in hospital for a hip fracture is 7 days. Patients with dementia stay in hospital up to 4 times longer after a hip fracture. The additional cost of this, and I know it shouldn't be just about cost, but there is a cost associated. The additional cost of this is almost £6,000, far more than the cost of an occupational therapy appointment. I just don't get it, I have to say, Ms. Rees, about why we're prioritising in this sort of way. I don't want to reduce health and social care decisions to pure finance, but the fact of the matter is that early intervention for people with dementia saves so much money. Alzheimer's Society reported on Monday that the cost of dementia to the UK economy is $42 billion a year, which will skyrocket to $90 billion by 2040 due to our ageing population. The cost of dementia rises significantly, however, as the condition progresses. So the average cost of care for someone in the early or milder stages of dementia is about £28,000 a year. In the later severe stages of dementia, it escalates well over £80,000 a year. Caring well for people with mild dementia can prevent falls and infections which cause unnecessary hospitalisations and deconditioning, which increases the speed of deterioration in people with dementia. Early identification and increased spend in early stages of dementia pays dividends down the pathway. So I'd like to end by posing 3 direct questions to the Minister and be grateful if she could address them in her response or in writing at a later date if that's easier for her. What is the Department going to do to make sure that where you live, your socioeconomic status or your ethnicity doesn't negatively affect your likelihood of getting a dementia diagnosis? What is the Department going to do to ensure that everyone with dementia has access to high-quality post-diagnostic care regardless of where they live? It was 2 years ago this week that the Right Honourable Member for Bromsgrove announced a 10-year plan for dementia. which was then folded into the major conditions strategy, and we still don't know when that's going to be published. So can the Minister update us on when we might expect publication of this strategy? Dementia is a monumental health and social care challenge and will be the defining test of our system in the decades to come. I have absolutely no doubt of that. We've spoken in this place about planning for the next generation of dementia care in the context of new, potentially transformative drugs currently under appraisal. But there are almost 1 million people living with dementia in this country today, and much more can be done to get them the care and support they need and deserve at the earliest possible moment. Again, I'd like to thank the committee and those who've joined us today on a Thursday afternoon when there's lots going on in Parliament, and I look forward to hearing the Minister's response. Thank you.
Thank you. May I remind members that they should bob if they wish to be called to speak. And the question is that this House has considered inequalities in dementia services. Holly Lynch.
Thank you ever so much, Miss Rees. It's always a pleasure to see you in the chair, so thank you for being here this afternoon. I want to start by paying tribute to my honourable friend, the member for Oldham East and Saddleworth. In preparation for today's debate, I look back at the previous contributions I'd made in debates on dementia, on Hansard, and was struck that every single one starts the same way, by paying tribute to her, because every occasion upon which I have spoken about dementia, it was in a debate that had been secured by her. Any time that I've attended an event around dementia or Alzheimer's, it has been an event hosted by her. She trained me to be a dementia friend back in a workshop in 2016, and she is the most incredible advocate on behalf of all those living with dementia and their carers and families, and I really do, with all sincerity, pay tribute to her for the incredible work that she has done on this cause. I am blessed, and we're blessed across Calderdale with some truly brilliant people and volunteers who work tirelessly to improve the lives of those living with dementia, their carers and loved ones. And I'll come back to pay tribute to them later on in my remarks. But at a recent event at Halifax Town Hall, I was asked to host a Q&A with Scott Mitchell. Scott was married to the wonderful Barbara Windsor for 20 years before she passed away, which was 6 years after she received a dementia diagnosis. Scott is one of the most incredible advocates for those with dementia, and it's been a pleasure to get to know him better following that event. There are many things I think Boris Johnson really got right in his time in office, but credit to him for setting up the Dame Barbara Windsor Dementia Mission, which launched in August 2022. And I was so pleased that Scott was officially appointed People's Champion for the Dementia Mission in March of this year. Scott introduced both myself and my honourable friend, the Shadow Secretary of State for Health, to the co-chair of the mission, Hilary Evans of Alzheimer's Research UK, recently, where I'm delighted to say that no one was left in any doubt that we very much support that mission 100% and would very much do so if we have the opportunity and privilege to be in government in the not-too-distant future. But the work of the mission really matters because, as my honourable friend has already outlined, the numbers on dementia are nothing short of terrifying, actually. There are nearly 1 million people living with dementia in the UK, which with an ageing population is set to increase to 1.7 million by 2040. That means 1 in 2 of us will be affected by dementia in our lifetime, either by caring for someone with the condition, developing it ourselves, or both. Sadly, it's the UK's biggest killer, accounting for more than 1 in 10 deaths across the UK, and nearly 75,000 people died from dementia in 2022, which is a 5,000 increase on 2021. Those numbers, sadly, shockingly, will be us. 1 in 2 of us in this room will be affected. It's enough to make you want to throw the whole kitchen, never mind the kitchen sink, at finding treatments and solutions for early and effective diagnosis and treatment pathways. I was grateful to the Alzheimer's Society, who were in Parliament yesterday in the event hosted again by my honourable friend, who told me that the diagnosis rate for those living with dementia in Halifax is 66.1%. So around a third of those living with dementia do so without a diagnosis which could unlock care and support. It's in everybody's interest to get this right. And again, my honourable friend has talked about, whilst we don't want to reduce people's well-being and health and social care decisions to facts and figures, to the finances, actually it makes clear that it's nonsensical to not get a grip of this, because it would deliver both economic benefits and transform people's lives potentially. Dementia has a huge impact on our economy. It costs in the UK £25 billion every year, and I think actually my honourable friend had some higher figures for that estimate than I've got. However, Alzheimer's Research UK are keen to stress that investment in research also has economic benefits. For every £1 invested in dementia research, it generates £2.59 within the UK economy. The Alzheimer's Society's recent report on post-diagnostic support for dementia, entitled Left to Cope Alone, engaged with over 2,000 people affected by dementia. Just 25% of them said that they or their loved one had had that annual dementia review within the last 12 months. Only 16% said they'd received enough support from local services in the last 12 months, which I'm sorry to say does reflect the experiences of too many families that I have spoken to and have met with. It has to be said that investing in the NHS workforce, in diagnostics, in research and treatments will pay dividends, and there is reason to be hopeful about the progress being made and the breakthroughs underway, as already touched on by my honourable friend. But now is the time to redouble our efforts and not take our foot off the gas. At a local level in Calderdale, as I've said, we've got some really, really brilliant people who've dedicated a great deal of time to go over and above to provide care and support for those living with dementia and their families. I want to pay tribute to Chris and June Harvey, who run the wonderful Memory Lane Cafe for people with dementia and their carers. Chris and June have been instrumental in not only running pop-up cafes in churches and community centres, in Soberbridge and in Halifax, but in setting up and delivering campaigns to make Soberbridge and Halifax as dementia-friendly as possible. Alongside Shbir Hussain of Bluebird Care, they've hosted events bringing organisations and local residents together in that aim, as well as engaging directly with businesses to urge them to consider all the ways in which those living with dementia and their carers can feel supported in shops, in stores, in the town centre. I certainly will.
Thank you, Ms Rees. Absolutely wonderful to hear about the work being done in Halifax. I think we can all think about our own constituencies, and so much of it depends on voluntary support and voluntary organisation. So I'm very lucky in Romford. I visited the Dementia Music and Social Club at the United Reformed Church, opposite my office actually, in Romford. Wonderful organisation that brings together lots of people from all over Havering who are suffering with dementia. Their friends and family go with them, and it's a very happy, fun afternoon every Wednesday. But they get no support. They have to raise all their own funds. They get nothing really from the local authority or the government or any other funding streams. Does she agree with me that we need to do more to support local voluntary efforts? Because people need support. They need families and friends around them, and bringing people together that having the same condition actually is a light in their lives and gives purpose back. And so important that we do more to support local communities, to support people that are suffering with dementia.
I'm grateful to the honourable member, and he is absolutely right. We've got into the real substance of the inconsistencies, the variations in the rates of diagnosis that really do highlight those inequalities where you are in the country. But beyond that, you've then got this real mix where so many local volunteers, brilliant groups, do so much good work, but that is not replicated evenly across the country. And he's quite right to say the difference that some of those groups make to people's lives, it is transformative. It is a lifeline, not only for those living with dementia, but also their families, their carers. If his local pop-up cafes and services or anything like the Memory Lane Cafe in Sawbridge Bridge, he speaks of what a great place actually it is to go and visit and be a part of. You know, there isn't that sadness. There is a shared sense of supporting each other, but lots of activities, lots of fun being had as well, and it makes a really, really big difference to people's lives. And he's quite right that with a little bit of local authority, government support, that could be replicated, that could be enhanced, they could be supporting more people. So I think he makes a really, really important point. In addition to the Memory Cafe, we've got a young onset dementia and Alzheimer's group, which was set up by Julie Hayden and provides support for younger people with dementia and for their carers, which I know is very much valued, especially by those who are of working age, diagnosed with dementia or Alzheimer's really quite early in life. But I also want to pay tribute to Chief Inspector Neil Taylor of West Yorkshire Police, who is the chair of Dementia Friendly Tom Midden and a Dementia Friends Ambassador. He has worked so hard to promote best practice within West Yorkshire Police, establishing the Herbert Protocol, where the police and other agencies encourage family and carers to complete a form with useful information that could be used in the event of a vulnerable person going missing. The protocol takes its name from George Herbert, a veteran of the Normandy landings who lived with dementia. So I'm grateful to them and those others who make such a big difference. But going back to the points we've just made, they are all volunteers. They're unpaid, which speaks to the very point of this debate. The provision of services is still uneven, and families and individuals who need to make use of services will find that that provision can vary significantly. They are local heroes, and I'm so grateful for all that they do. I look forward to the Minister's response, and can I thank once again my honourable friend for having secured not only this debate but all that she does.
Thank you. Opposition spokesperson,
Thank you very much, Miss Rees, and it's a pleasure to serve under your chairmanship. And can I yet again commend my honourable friend, the member for Oldham East and Saddleworth, for securing this debate, but also for her ongoing advocacy on this issue. I also want to thank the other members here. We're a small but perfectly formed debate, and particularly my honourable friend, the member for Halifax, for her important contribution as well. And she is absolutely right, not only to champion those really important services that are being provided in her patch and across the country, but that desire to want better and to want more of that, so that no person or family looking after somebody with dementia is left behind. That wraparound support is so absolutely crucial. I also commend her and my honourable friend who opened the debate for thanking those national organisations and charities and local organisations and charities and all the wonderful army of volunteers that keep dementia on the public policy platform, and also to the honourable gentleman, the member for Romford, for his important contributions through interventions, because it's absolutely right that we have to approach how we deal with dementia in the 21st century on a cross-party basis, and I hope that we can reach some consensus on what needs to be done, because Ms Rees, never has the need for a clear, concerted focus on dementia been more pressing. It is one of the biggest health and social care issues facing our society. Almost 1 million people, as my honourable friend pointed out, in the United Kingdom live with dementia, a figure that is expected to rise to 1.4 million people by 2040. But behind these numbers lie individual people with their own distinct circumstances and challenges and their own unique stories of living with dementia. It's a cruel condition. It's one that strips people of their fondest memories and causes devastation for families. Dementia can impact anyone at any time. It's indiscriminate in the impact it can have, but we know that certain groups are at increased risk. We know that women are more likely to develop dementia than men. They are also more likely to be caring for a loved one living with dementia. We know that those from poorer and disadvantaged backgrounds are more susceptible to key dementia risk factors with often limited access to health services. And that's why my honourable friend is absolutely correct to refer to these as health inequalities, Miss Rees, because it is often those living in the poorest, most adverse circumstances that face the hardest challenges, not just with this condition, but with a whole number of conditions. And if we want to live in a better, fairer, more equal society, we have a duty to bear down on those inequalities. I completely agree with her in referring to these as health inequalities. People from ethnic minority backgrounds are also at higher risk, as are those with conditions such as Down syndrome. But the population living with dementia is expanding all the time. It's clearer, I think, than in adult social care. Around 60% of people drawing on home-based care and support services live with dementia. That will rise to 70% for those in residential care. So we need long-term solutions that reshape social care into a service that is fit for the future and fit for the challenges of the future. That's why, Miss Rees, I am proud of Labour's commitment to a 10-year plan for fundamental reform of adult social care, culminating in the creation of a national care service. The NCS will employ robust central frameworks and standards, but they will be underpinned by locally led delivery. Every community will have its own unique set of needs and face unique challenges and require unique solutions. One of our aims will be to gradually reduce the postcode lottery that operates within social care that causes people living with dementia and their families so much distress. But a reformed and reshaped social care sector alone cannot and it will not meet the needs of an ever-growing population of people living with dementia. I will give way.
I'm really very interested in some of the things he's saying, and I'm glad that he approaches this from a cross-party point of view. I go back to my own borough of Havering, which is such a vast number of older people, and so many services for people that suffer with dementia. They depend on local authorities to support these things. But in Havering, we don't get the additional funding we need to deal with the population that we have, the older population that need those services. So if there were to be a change of government, would he commit to helping boroughs like Havering, giving more resources so that where you do have a borough with a very large population of older people that suffer with dementia, will they get more support from the government that he may well be serving in?
Well, I would certainly hope and expect so, because, look, the way that we are going to deal with the National Care Service, we're not going to create a big monolithic organisation to rival the NHS as some kind of super organisation employing lots of people. The National Care Service will be about the centre setting out a clear national direction of how we deal with the challenges of social care, what the pay terms, conditions of the workforce should be, and what the outcomes should be for people drawing on social care services. And that strong centre then means we set out the what, The how has to be determined locally, because what works in Oldham won't work in Romford. There will be best practice that is done in Oldham that will transfer over and can be upscaled to Halifax or to Lewis or to Romford. And that is also a job of the centre, to promote that best practice, what works, and to encourage other authorities to do that. But the funding challenges require an integrated approach. And I saw that firsthand, how it could work in my own local authority, because for a very small period of time, unpicked by the latest round of structural changes, but Tameside Council was also the clinical commissioning group for Tameside and Glossop. And by bringing the local authority and the CCG together under a single leadership with a single budget, made some really smart decisions as far as it came to dealing with adult social care. So I know what integration looks like, and I know it works, and I know how we can get a better use of the public pound by stripping out some of the duplication. I'll give way.
Just a very small point of clarification. I'm very pleased by what he's saying, and there should be, common cause over this issue. But does he agree with me that the important thing is that the funding follows the individual, that it shouldn't matter which part of the country you live, or if you're on that side of the boundary of a borough? I mean, my borough is within Greater London, and we get very poor funding because all the money goes into the centre for all sorts of areas of local services. And the Essex County Council is just up the road, so we always get calls. So can he assure me that any policies he may bring forward, the money will go directly for the needs of the individual, rather than one person on one side of the boundary getting the funding, a mile down the road they don't get the support they need?
And that's why we need to have a strong national framework with an expectation that these services are delivered to the required outcomes with very strong targets across the whole of England. Look, I get the nuance between local government finance and the interrelationship with adult social care and NHS budgets. And we've got to be smarter at working around all of this. As a former Shadow Secretary of State for Communities and Local Government, I realise, Miss Rees, this is not a debate on local government finance, but the two are interrelated. And I do take on board the Honourable Gentleman's point. But in order to get that reformed, reshaped social care sector, and particularly in the scope that there is going to be an ever-growing population of people living with dementia, we need to fix the crisis in our NHS, which is intrinsically linked with our social care system, to address the inequalities in dementia care. Now, that care starts, as we've already heard, with timely and accurate diagnosis. A third of those currently living with dementia in the UK do not have a diagnosis. That prevents them from accessing vital care, the support they need, and treatment. But it is also about allowing people to have some degree of certainty and to make different life choices based on that. Look, if I found out that I had early onset of dementia, I could access, hopefully, Miss Rees, some of these new drugs that are available. In doing so, I would hope very much that I could tick off a few more things on my bucket list. I might want to spend more time with my family, take them on a chance of a lifetime holiday, make memories. People are deprived of making those choices. But I don't think, Miss Rees, that it's good enough to have a third of people left undiagnosed. That's the national target being met. And as we've heard, in large parts of the country, it's not being met. I want us to get to a much more rigorous national target. Look, if Stoke can diagnose 90% of people with dementia, so can the rest of the country, because Stoke is not a rich area, it's not a well-resourced local authority, its NHS isn't awash with any more cash than other areas of the country. If they can get 90% so can the rest of the country with concerted effort. And that is why, Miss Rees, having a strong central target and an emphasis from the Minister to get this as a priority is going to be important, and it will be the priority of the next Labour government to increase that target and to demand that local systems not only meet that target but exceed that target, because this is people's lives. Miss Rees, earlier diagnosis, as we know, means better care, better outcomes. It could not be simpler. As I say, the national target of 2/3 is not good enough. I'm not content with 1/3 of people, and even less in many areas, failing to meet that target, living with dementia and going out without that vital care. But also, with primary care under such immense strain, people just simply cannot get through the front door. That's why the next Labour government is committed to making the future of general practice sustainable and to take pressure off those currently working in the system. We'll bolster the workforce so that all patients, including those with dementia, can get timely care, which is why Labour will deliver on the NHS long-term workforce plan to train the staff the NHS needs now and in the future. Once a diagnosis has been made, continuity and ease of access to care is crucial to long-term outcomes. That's why one of the fundamental shifts the next Labour government will deliver in our health and care system is taking focus of care out of hospitals and into the community. And unlike the last time that was done, principally with people with dementia and learning disabilities, the money has to flow from hospital to community as well, which scandalously didn't previously happen. Labour will work with the NHS and social care providers to bring services together in local communities. It is by having these services embedded where people are that we will deliver another crucial shift to a health and care service relentlessly focused on prevention. Because Alzheimer's Society research shows us that mild dementia costs £29,000 per person per year compared to £81,000 for severe dementia. That provides us proof, if ever we needed it, that the case for focused prevention is clear. Not just on patient outcomes, but on financial sustainability of services too. But as well as looking at the here and now, we must also look at the challenges on the horizon. Our understanding of dementia is constantly evolving. It's why continued leadership in research and embracing the latest technological advances and developments is so vital to ensuring we stay ahead of the game. Labour is committed to putting Britain at the front of the queue for new treatments by boosting clinical trial activity in the NHS. We'll speed up recruitment to trials and give more people chance to participate. We will link up clinical trial registries to create a national standing registry and harness the power of the NHS Act to invite eligible participants to take part in research studies that they are eligible for. And in closing, Miss Rees, I want to pay tribute to a group so vital and yet so often forgotten: unpaid carers. Hundreds of thousands of people care selflessly for their loved ones living with dementia. Make no mistake, without the work of unpaid carers, the system would simply collapse. With 63% of the total cost of dementia being borne by those living with the condition and their families, we know just how raw a deal they are getting. They are a vital part of the fight against dementia and will be at the heart of our plans in government. We will have a carers strategy under the next Labour government because we value the vital work our carers do, and it will be a cross-government strategy with the DWP, with education, with future of work, all feeding into it with the Department for Health and Social Care. Miss Rees, there is a brighter future for those living with dementia and their families and carers, and Labour will deliver it.
Minister Maria Caulfield.
Thank you, Ms Rees. It's a pleasure to serve under your chairmanship. And can I start by thanking the Honourable Member for Oldham East and Saddleworth for securing this debate about inequalities in dementia services, but also her work across this issue and doing it in such a way that is so collaborative and brings everyone together. And she's absolutely right to point out that dementia is not an automatic part of ageing. I think there is still that stereotype very much outside that perhaps does not recognise that, but also the issue around young onset dementia too. Very often there are very young people with dementia who also struggle to get the help and support they need because it's often seen as a disease of old age. I think, it's incredible the way she describes her own experience of caring for her mother, Angela, and how difficult that must have been. I think most of us have been affected by dementia in some way, but my mother-in-law died from dementia last year, and it's a terrible, with all the issues that have been raised in this debate, just seeing someone you know and love change in often such a dramatic way. It is difficult, even if with the best care and support that's available in the world. The Honourable Member for Halifax talked about the good experience she has in her community with local services and the importance of dementia-friendly communities, and she's absolutely right. And again, the Honourable Member for Romford contributed with his own experience of the changes he would like to see in improving the care and the experience of those who suffer with dementia. The All-Party Parliamentary Group on Dementia does fantastic work, and again, the Honourable Lady, in her role as chairing that, is doing quite groundbreaking work, particularly around the reports, the surveys, to flag many of the issues that are evidence-based in the experience of those in dementia, in both providing services but also looking after loved ones. This is Dementia Action Week, and I would just like to thank everyone who's involved in supporting people with dementia, and particularly, as the Shadow Minister said, unpaid carers as well. Can I just then turn to and just reassure members about how passionate this government is about improving care, and we do have a clear mission to make our NHS and social care system much more responsive to the needs. The Honourable Member for Halifax points out the work of the former Prime Minister Boris Johnson in working to set up the Dame Barbara Windsor Dementia Mission, and how important that is, but also the previous Prime Minister David Cameron instigated a lot of work in terms of research in this space as well. Because when, and I say this with my women's minister's hat on, when the leading cause of death in women is actually dementia, and because we know that 1 in 3 people will be diagnosed with dementia in their lifetime, that's by 2040, 1.6 million of us living with this condition, that it absolutely has to be a priority, both for diagnosis, treatment and support. I welcome the research this week from the Alzheimer's Society highlighting the economic impact and further outlines why dementia must be a priority. And absolutely right, I think the theme from this debate today is about the inequalities that exist across the country and the wide variety of experiences in getting a diagnosis, getting support and the help and care that people need. I do think, yes, we can put more money in, and I'll outline some of the funding we're putting in. We can put more resources in, but I do think there's also a cultural shift that we need to develop, because while dementia is just seen as a natural part of ageing, very often people with dementia, with diagnostic overshadowing, have other health conditions that are completely ignored and are just taken as something that's part of that dementia diagnosis. So when someone has a UTI with dementia, very often they will be confused, they will be agitated, they will be kind of crying out in pain sometimes, and that's seen as just part of their dementia. And actually with some simple antibiotics, treating that UTI, they could improve quite considerably. And I think sometimes we do also need to look at the culture around dementia across the system as well. Now, I just want to highlight some of the work that we are doing to both look at diagnosis, treatment, and some of the research that's happening already. I take the Honourable Member's point about the central database around data. Each ICB holds their own individual database, but I will go back to colleagues at the Department of Health to see if we can better bring that together, again, to look at those disparities that are happening across the country. Last year, we did announce our decision to publish a major condition strategy. Dementia is one of those 6 conditions covered in this strategy alongside cancer, cardiovascular disease and other major conditions. And I think it is important that it is seen as a major condition and not just something that is a part of ageing. And part of the work that we need to do is around that timely diagnosis of dementia to make sure that anyone with dementia can access advice, information, care and support. And our ambition is for 2/3 of people living with dementia to receive a formal diagnosis. And I know the Shadow Minister knows probably not what I'm going to say. Absolutely, what he says sounds wonderful. But actually where, Labour are in charge of healthcare in Wales, their ambition in their Dementia Action Plan is to increase diagnosis by 3% a year. So absolutely, we all want to see a diagnosis, but I think we also need to be kind of realistic that in some of the ambitions elsewhere, that's not always been the case.
I'm very grateful for the Minister giving way. Can I just point out to her that I seek to be the Social Care Minister for England, not Wales, and as she is the current Social Care Minister for England, not Wales, can she please be a bit more ambitious for England?
Minister.
Well, I think it's ambitious that 2/3 of people living with dementia do receive a formal diagnosis, because we're not there yet, and there are some building blocks that we're putting in place to improve those. And we do know that the pandemic had a significant effect, because we did shut down routine care for about just over 2 years. And going to be able to see your GP with concerns about potential symptoms of dementia was very, very difficult to do. And so it was conditions like dementia that did suffer as a result of lockdown. But we are recovering those rates, and there's a lot of work going into that. But I do absolutely recognise that some parts of the country have made a better recovery than others, and that absolutely has to be a focus of our work going forward. NHS England has committed to recover dementia diagnosis to that national ambition, and are providing clear guidance to those ICBs, particularly where performance is not where we want it to be, to make sure that that is the case. And as part of the spending review in 21-22, £17 million was allocated to the NHS to address dementia waiting lists and increase the number of diagnoses which have been adversely impacted by the pandemic. And NHS England is funding an evidence-based improvement project to 2 trusts in each region, 14 sites in total, to pilot diagnosing advanced dementia mandate tool to improve that, so people know what they should be doing when trying to get that diagnosis, particularly also in care homes as well, and for those people who may not have friends and relatives to advocate on their behalf and to get a diagnosis in the first place. We touch a little bit on research, and I just want to pay tribute to those charity partners who are working with the National Institute for Health and Care Research in trying to find diagnostic tools to better diagnose at an earlier stage. And things like blood biomarker and the blood biomarker challenge, which is seeking to produce the clinical and economic data to make the case for a blood biomarker test in healthcare across the UK, so including our friends in Wales, to improve dementia diagnosis, because that is the way that we're going to really find out who is at most risk and get them diagnosed earlier. And we're committed to supporting that research, and we'll double funding for dementia research to £160 million a year by the end of this current financial year. That will will not just be around diagnosis, it will be around treatment and other research elements as well. And absolutely, the Dame Barbara Windsor Dementia Mission is deeply embedded in that work, and I thank them for their work on that. I just want to touch a little bit on prevention of dementia as well, because again the research that's going into this with the National Institute for Health and Care Research is investing £9 million to funding the 3 schools dementia programme because there must be risk factors for dementia that we are unaware of at the moment. And this vital research could be a game changer in the future. The National Institute is also supporting the PRIDE study, which aims to identify how social and lifestyle changes could reduce the risk of developing dementia at any part of your life. I was going to say later on in life, but can affect any age group as well. Now that takes me on to treatments, and we do know that there are drugs currently being appraised by the National Institute for Health and Care Excellence, NICE, to determine whether they should be made available in the NHS. And I know many people are waiting for those appraisals and are hoping that they are positive. We expect NICE to publish guidance in July and September, respectively, and we want to make sure that if it's a positive decision, that we're able to ensure fair and equitable access to any licensed and approved medication. So we will hopefully hear very soon about that. I just quickly want to touch on post-diagnostic support, because I think that's a key element that is the reality of most people's experience of dementia at the moment, because everyone should have access to meaningful care. And I want to touch on the work of Admiral nurses, who do a tremendous job, but again, they're not available everywhere. And it is really down to individual ICBs to commission those services, but also to say that the additional roles reimbursement scheme that is available to primary care networks, to GP practices, does allow for enhanced nurses in relation to dementia care to be employed. And so I would encourage MPs in their local areas to check with their local PCN, with their ICB, with their GPs, to see if that is something that they are using the additional roles scheme to report, because Admiral nurses do a fantastic job. It's not just about supporting people and their families with dementia. I know one of the critical areas is around continuing care applications. Very often people with dementia are turned down for continuing care, and Admiral nurses often will get those decisions overturned. I'm not kind of commenting on that, but they have that experience that sometimes people with dementia, it may look like social care on the surface, but actually it is clinical care, it's nursing care, and so that NHS social care divide can be bridged. Similarly, local authorities have a duty under the Care Act of 2014 to provide or arrange services that meets the needs of the local population. And I know the Honourable Member for Romford talked about various conflicts between neighbouring local authorities. Actually, why we brought in integrated care boards was to try and bridge that gap, not just between NHS and social care, but to bridge that gap between neighbouring local authorities. I would encourage him to speak to his ICB to see if there's anything they can do for individual patients to better commission services, so that it doesn't matter which edge of a borough you live in, that care can be a bit more joined up. Oh, of course, I will.
The Minister talks about which borough you live in, but what if your borough is on the edge of a region? So Havering is on the edge of Greater London. Down the road is Essex. Now, we'd actually rather be Essex, to be honest, but we are stuck where we are. So does that also include being able to work with authorities which are beyond the boundaries of the region that we're in?
Minister.
Yeah, absolutely. I mean, ICBs should be looking at the care in their local population, and if there is an issue between regions and borders, they should be having those informal conversations, even if it's with a neighbouring ICB in a region, to try and join up those dots. That's why they're called integrated care boards. It's to integrate health and social care, but also integrate geography and any kind of logistical local authority boundaries too. If that is something that's a significant issue across the kind of Essex boroughs border, we're very happy to meet with local MPs to discuss that, because it is about joining up those dots and getting that better connected care. And that's really how it's good local relationships that can improve local services. We will be publishing ratings of how well local authorities are delivering adult social care and supporting local authorities to improve their performance. So I'm particularly interested if there are geographical boundaries that are preventing some of that work. And I just want to touch on the social care workforce as well, because the social care setting is integral to supporting families, and particularly unpaid carers. And we need to have a workforce who are equipped with the skills that they need. We have set out and commissioned and funded the Dementia Training Standards Framework. and develop this in partnership with the sector. And this framework sets out the required essential skills that we expect to be applicable across the health and care spectrum, and we would expect social care to be training their staff according to that framework as well. We've also just launched the Care Workforce Pathway. It's the first ever national career structure for adult social care workforce, and that's really important to cover the complexity of conditions that they now care for and have a career pathway, so that the option isn't to work for a little bit in social care and then go do something that's better paid. We want social care to have that career progression and that pay progression as well, by staying in the job that people love. And we've created a new care certificate qualification to end the current practice of care workers having to retrain every time they work for a new employer. So there is work happening in this space. And just once again, just to echo the Shadow Minister's point about unpaid carers, we know the vast majority of care is given by people who are looking after loved ones and friends, and they do an amazing job. Local authorities are required to undertake a carers assessment for any unpaid carer. I will give way.
I'm so grateful for the Minister giving way again. And I mentioned earlier the Dementia Music and Social Club, which is based in Romford. They meet at the United Reformed Church. As I mentioned earlier, they do a magnificent job. I hope she would commend the work they do. But they struggle because there isn't any direct funding for them. Now, would the government consider having some kind of community chest to support local groups that are organised by volunteers and families of those who are suffering with dementia, so they can have some funding for special events, for day trips out, for social activities, because that's so important, making the lives of those that are suffering with dementia so much better, and bringing families and local people together to make sure that they have the best possible life with the condition they're living with.
Minister.
You know, I absolutely recognise what he says. I will take away his suggestion, but what I would say is that integrated care boards can commission those sorts of services, because while they're not a medical service as such, they are providing a valuable service to those patients. And also, under social prescribing options, again, local GPs can use funding they have to use that for social prescribing, so that if someone's going weekly to those events or on a regular basis, social prescribing is there to help exactly that sort of activity, because it's a health and well-being activity that makes such a difference. So very happy to kind of follow up on his suggestion.
Very welcome, and she could see how effective a local group is in providing that community support.
Yeah, no, absolutely. I'm very happy to take him up on his offer. But it's important to remind people that there are some funding avenues available, and they're not always used. And things like social prescribing has got some funding attached to it. And I think it's important that we remember that as well, because it needs to be sustainable pots of funding. We often give grants out as government, and they're one-off grants, which make a big difference, but they don't always lead to sustainable funding routes.
Members and give us details of funding streams that are available, so we can disseminate that information to groups in my constituency and other members who would benefit from that.
Minister.
Yes, absolutely. I'm very happy to take that away as an action point. So can I just thank everyone for taking part in this debate. I think we recognise how difficult it can be for people diagnosed with dementia and their friends and family. We know we've got work to do in improving diagnosis rates. We are seeing improvements, but there's a lot more work to do. I think that it's the research and development that will really transform the way we manage dementia and find out who's at risk, diagnose them early, and get some treatments in place. They will be game changers, I'm sure, over the next few years that will make a difference. But in the meantime, we have to better support people and their families with dementia. I hope I've demonstrated today that the government absolutely is absolutely supportive and sees this as a top priority. And once again, I'd like to thank all members across this chamber for taking part in the debate today.
Thank you. Debbie Abrams to wind up.
I'll be very quick because I know people have got trains to catch. But I just also want to reiterate the Minister's comments about thanking everybody for taking part. I think this has been a particularly nice debate in its collaborative approach. And I thank her also for saying that she will follow up around the data that she's going to look at that could be retained centrally. On the major conditions strategy, I also hope that there's evidence that's been supplied here and elsewhere that will help strengthen the dementia aspect of that. And on that last point, in relation to type-specific diagnoses as well, which we haven't talked about, if she could possibly look at making sure that's included, because access to the therapies won't be available without that. Thank you so much.
The question is that this House has considered inequalities in dementia services. As many as are of that opinion say aye. Aye. Of the contrary, no. I think the ayes have it. The ayes have it. Order, order. The sitting is suspended until 2 p.m.